Hello, this is Dr. Janet Hall and I'm a psychologist, author, hypnotherapist and a sex therapist from Melbourne, Australia, where I have my Richmond Hill Psychology Clinic. I'd like to talk to you today about a very common problem and how you might fix it. The problem is, how does a woman who's nurturing, loving and looking after tiny children find her libido, which has been lost because of pregnancy and looking after the kids? Very common and upsetting problem for the partner in particular. And I have a lot of experience in coaching women whose partners basically have said, "It's not fair, honey, please go and see a sex therapist." I wanted to talk to you about one in particular that has inspired me recently. And her husband and she went to a couples counsellor, and I want to warn you about that because a lot of couples counsellors might say or even imply that they do sex therapy, and you should ask them very carefully how much experience that they've had, because they may indeed just give you the runaround and have 2 or 3 sessions where they want to know all about your background, but they're not actually doing any sex therapy. And I think you'll find, because of what I'm explaining that I could achieve in 1 session, that it's much better off seeing an experienced sex therapist. So this problem, you know, when should the partner start to split the dummy if he's not having good sex again? I like to think of waiting until, you know, the youngest baby's at least 1, because, you know, a breastfeeding, busy mother who possibly is sleep deprived, and maybe the partner's sleep deprived too, needs a bit of understanding and leeway. But if the baby's about 1, and in this case, this woman told me that best practices in Australia is to breastfeed until they're age 2. I didn't know that, but I would have thought that 1 would have been enough. But anyway, you know, your baby might be thriving on breastfeeding, and so if that's you, keep it up. Nevertheless, it's kind of one of the reasons why. I mean, if a mother is associating her breasts with feeding a child, she may not really be in tune to the fact that they're very sexually pleasurable as well. So maybe there's time for some breast loving, breast massage by a partner to get her back in tune with that. Now, in this case, the woman had 2 small children. One was 3 and one was 1. And as she was chatting to me, she said that couples counsellor had said that she was really proud and happy to see the interaction between husband and wife. And she said, "Look, go away, you know, and just wait for this problem to sort itself out. It's so very common." But the couple were not happy with that, and I think that when you hear what I've got to say about what I said to her, you'll see why. You see, she told me that during the pregnancy there was quite a bit of a scare that she might lose that baby, and so her medical carers said, "Could you please, you know, not have sex? Sex could actually cause, you know, you to have to terminate naturally." So of course, you know, the couple followed those guidelines. And the woman just continued to talk about other things, like how tired she was and that she just lost her mojo. So what I suggested was, well, first of all, I wanted to know, how good was sex before you got pregnant and started to have a family? She said it was great. She said that she was very in touch with what I call her naughty girl. Because you see, there are some women who kind of fake being sexy until they have children, and then, you know, they own up to the fact that they're really not that much into it. They probably don't have orgasms, and they don't let themselves really enjoy sex. I call them the good girls. They are suffering from, you know, dermatitis. Well, in this case, it's called good girl-itis. So my lady said that wasn't her, that she was very in touch with the naughty, the cheeky, the lusty lady inside of her prior to having children. And she said that she had a cupboard full of lovely, sexy lingerie, and she had been very used to using her vibrator and letting her husband use the vibrator on her, and had been having luscious orgasms, particularly through oral sex. So that was great. She had all the essentials there. Oh, she also said that she'd regained her figure, so that she wasn't self-conscious, a little bit of flab, and you know, that's what happens after you have a child, but in general she was feeling pretty good about her body image. She said, I just don't put my mind to having sex. I really don't remember why I was so interested. So I said to her, well, let's start off with maybe making sure that you're going to please your husband at least once a week so that he's got something to look forward to. So, so she agreed to do that, that she would give him a hand job once a week. And then I said, but to tune yourself in for a proper session with him, what about we choose Saturday night? So once you get those little children into bed, that you'll go take a shower, maybe get a glass of wine, and that you will warm yourself up. And that meant that she had to get her vibrator and go and actually tease herself, arouse herself, so that when she went to her husband for some nice luscious kissing, she'd already kind of, tuned herself up. So they were the two good ideas that I had to start her up. And maybe there'll be a sequel to this video, and I'll teach you some more. But until then, if you'd like to ask me any questions or get in touch or want to arrange a session for yourself, please just email me, jan@drjanethall.com.au, or if you'd like to find out more about my MP3s or ebooks, go to my shop, www.drjanethall.com.